From Florida's Space Coast, this is Your Career.
Welcome to Your Career. I'm Debbie Featherston, your host, and with me today is Liberty Rovira. And Liberty, her specialty is an area that you are going to be most intrigued and fascinated by, at least I was. Informatics, and specifically clinical informatics. Liberty, thank you for taking time out of your day to come and help to educate us on this subject that, well, by its name, doesn't tell me much. I can kind of guess, but if you would just kind of describe or give us kind of an introduction to informatics, what does it mean? Where did it come from?
Sure. Well, first, Debbie, I want to say thank you for having me. It's a real honor to be here on your show. Informatics, the word originated from France.
Okay.
And it has to do, or the definition of informatics is computer science plus information science. And when the term is used in conjunction with the name of a discipline, it denotes an application of computer science and information science to the management and processing of data, information, and knowledge in the name disciplined. So when you combine the terms clinical informatics, then that has to do with the clinical domain.
Okay. So informatics really is something that can be applied to a lot of different industries.
Yes.
But in your case, it's the medical field.
Healthcare field.
Healthcare specifically.
Right, because medical informatics is a specialty in and of itself that has a different, its nuances that are unique to medicine.
So what are some of the specialty professions? Because you clearly have educated me, there's a big difference between medical and even clinical. So that's, for somebody that's not a practitioner in your field.
Clinical informatics is a broad and complex field. So it can include areas like nursing informatics, pharmacy informatics, public health and population informatics, consumer informatics, and it could go on, based on the discipline. Like you can even have veterinary informatics and dental informatics. And so what they all have in common is all these disciplines have data, information, and knowledge.
And so what they're trying to do then is to use that information, capture that information and use it in some specific way then.
Right. It has to do with capturing the data and then turning the data into information, and then from that information create knowledge about that discipline to inform or to conduct more research in order to improve the outcomes.
So tell me a little bit about clinical informatics, specifically, when you think about nursing informatics, because I've heard the term nursing informatics many years ago, and I don't know if that's still a term that would be used or not. Can you elaborate on that?
It's still being used. I like to think of clinical informatics as this umbrella. And underneath the umbrella, you have all of the different healthcare disciplines, which include nursing, pharmacy, nutritional informatics, and so forth. So you've got all these different disciplines under the umbrella of clinical informatics. So let me just give you an idea of clinical informatics. It's the study of information technology and how it can be applied to the healthcare field. It includes the study and practice of an information-based approach to healthcare delivery in which data must be structured in a certain way to effectively be retrieved and used in a report or evaluation. Now, with nursing informatics, it's the combination of computer science, information science, and nursing science designed to assist in the management and processing of nursing data, information, and knowledge to support the practice of nursing.
Okay.
So it's very unique to nursing.
Okay. So it's more limited in scope.
Precisely. Because nursing has its own data elements, and then there's a nomenclature, there's a lexicon that's very unique to nursing that is not, doesn't include the other disciplines like pharmacy or respiratory therapy or medicine. So that's why we have a unique area called nursing informatics, and it is still being used.
Okay. I should have started with having you just introduce and give us a little bit of a thumbnail sketch of your background around this. You've been in this field for how long, clinical informatics?
I would say over 14 years now.
Over 14 years. But you started as a nurse?
Yes, I did. And that's how typically an informatics, a health clinical informatics professional gets started. You have a clinical background, it's typically nursing. And you have several years of experience with hands-on patient care. And in my case, I was in critical care for over 7 years. And during that time, I was exposed to a variety of computer systems, clinical information systems, monitoring systems, physiological systems. And so from that exposure, I took the more traditional route, meaning I went back to school and got my degree in management information systems. And then after that, I gained experience in the industry, being technical support and so forth. And then I got my master's degree in healthcare informatics. So the field is not like you can enter at a bachelor's level. You must have had working experience in a hospital setting with hands-on patient care, and then go on to get your graduate degree. So it's an advanced practice degree.
Wow, it is very involved, and you are very committed. It's almost as you have to be really ingrained in the field. I'm thinking about the law degrees and some of the others, but this is even more involved than that, it seems.
Yes, and then you've got to to learn the technology that's constantly evolving. So I had courses in computer science, systems analysis and design, user interface design, and they're just tools to be used in the healthcare domain.
What really attracted you, Liberty, to the field of clinical informatics? Why move from nursing into this area?
Yeah, I just was very interested in the role of technology, and it being used as an enabler to make processes more efficient. The delivery of care, have it be more efficient and improve the quality or the outcome of healthcare services for the patient.
That is very commendable. That's something, as much as that is important to me, I would never be able to do it because I don't have the passion for the technology, quite honestly. I mean, I love to use computers and all that kind of thing. What are some of the core functions or tasks of somebody that's, a clinical informatics professional? Just to give the audience, particularly young people who might be thinking, or nurses that are trying to debate, do I really want to move this direction or not? What's really involved? Well,
There's this systems life cycle in informatics, and it's divided into stages, and each stage has a role for the informaticists. The stages are systems analysis, systems design, systems implementation, systems maintenance, and systems testing. So that's the life cycle, and for each one of those phases, those are the roles you would do, or you would perform.
Wow.
So in other words, I've done systems analysis, and I've had to define requirements for the end users. What do the nurses want to see on their screen displays? What do the doctors want to see on their screen displays? What data elements do they want to collect in order to, to create the information that they want to see on their displays, as well as conduct research? So that would be a systems analysis role. And then you've got your system implementation, when you've got a clinical information system that you want to deploy in a healthcare setting. So you need a team of people to implement the system. So each phase of the system's life cycle defines the role, and those are the core roles. The additional roles you would have are project manager, change management, and then you've got education is a big piece, because once you've got a system implemented in the hospital, then you've got to train the users or educate the users.
It would seem to me that what you're really doing in this role is that you are, it's very complex. It's almost like engineering to me, in that you're out there assessing, doing a needs assessment, trying to determine what the real needs are, what's the information they need, how do they want to collect it, how accessible does it need to be, what does it need to look like, and so you're actually in a way doing some software development, or at least impacting and influencing software development.
Well, that's where you transition from analysis, where you do the needs assessment, then you go over to systems design, where you now start designing the system based on what the users want.
And this information typically is used in the care of patients?
Yes, or it's used to, right now the big thing in informatics is population health. So a lot of data is getting retrieved from all these little, repositories, and they're being analyzed, and we're looking at how populations are doing with disease management. Oh. So there's like a bigger level of this.
So this actually supports research and analysis in terms of overall health care, try to project maybe future needs for health care.
Yes, and it also helps, retailers like, the Walmarts and the CVS as to, given this, we've got this population in this community, how many, products for diabetes care do we need to carry? Mm-hmm. So they also tap into that data.
Wow, that's fascinating. In just a few moments, we are going to take a break, but before we do that, I'm curious, what have you found to be, in just the next minute, what have you found to be a couple characteristics or skill sets that really are important for a person to be successful in this role?
Well, I think number one, they have to be adaptable, because healthcare is very complex. They have to have critical thinking skills, which you develop as a nurse. Mm-hmm. And secondly, they have to be a systems thinker. They have to be able to, look at the organization and what they're doing as a system.
Well, thank you for that. We'll be coming right back. We're going to take a break, and we'll be right back. You're watching Your Career. I'm Debbie Featherston, your host.
With each new day comes a renewed call to greatness. At Eastern Florida State College, we are rising to lead the way and build our better future now. With a unique group of emerging leaders who are striving here today to impact our global tomorrow. This is where new voices are heard and new dreams ascend. Where vision is shared, ideas are exchanged, and careers take flight. This is where heart and dedication ensure a mutual resolve that rises to meet new challenges. This is where compassionate commitment creates higher achievement, and bold steps lead to bright discoveries. This is where a proud heritage meets passion and excellence. Where we come together in a close community to push further and go higher, lifting us all. This is where we choose to stand, with people who care, in a place we love, to pursue purpose with courage and confidence. This is where we achieve distinction, seize the moment, and follow our hearts to the destination of our dreams. Successfully, together. Eastern Florida, where titans rise.
Welcome back. You're watching Your Career. I'm Debbie Featherston, your host, and with me today is Liberty Rovira, and we are talking about clinical informatics. Liberty, this has been very fascinating and very educational for me, because I heard the term informatics way back, probably 25, 30 years ago when I was living in Indianapolis. There was a gentleman that worked at IUP while I actually was teaching, and he brought up this term, and I thought, what is that? So this is just to be able to get to know and tap into your personal experience and depth of knowledge is very enlightening, and I know that others may be, really interested in this field, so thank you for sharing your experience. I'm curious, where do you see, what do you feel is the greatest trends that may be impacting the field today or in the near future?
Okay. Well, today, the main trends are the Affordable Care Act, the development of these accountable care organizations where hospitals are pressured to consolidate and practitioners are integrating, you know, in line with these organizations. And it's a way to kind of like reduce the cost of healthcare. And that's creating a lot of problems in informatics, because as hospitals are consolidating, you've got hospitals that have different kinds of clinical information systems. And so how do you get the sharing of data amongst these now consolidated hospitals? So that's, you know, a big trend going on. And also now there's the emergence of population health management. How do you collect the large amounts of data and then archive it, warehouse it, you know, unless you have these big information systems. So, I mean, there's going to be a lot of activity around population health management. Now, in the future, there is an untouched segment, and that's the post-acute care. We're talking about nursing homes, hospice, assisted living. They are still in the paper records.
Okay, so that's an untapped field is what you're saying.
Exactly.
Wow.
All the activity has been in the acute care settings, okay? But it's just the post-acute, they've not automated yet. So they've got a lot of catching up to do.
I'd say so.
Okay.
So where does one start?
Well, I mean, that's a nice place to start if you want to start, you know, entry-level job.
Okay.
That would be a good place to start, is in the post-acute care area. Current trends and the future, those are going to be the trends that have been, you know, brought to my attention.
And how do you see those trends impacting the work that you do? Is it increased volume? Is it, you know, just and that, when I think about the affordable health care, you know, I've got customers who were in the healthcare field, cardiology group and a practice group and a couple others, that they are just scrambling. Last year especially, they were really scrambling to make certain that they were compliant. So, you know, and then when I think about these huge physician groups that have merged with the large hospital systems, right? What implication does it have? All I think about from my outside perspective and understanding is volume of work.
The volume of work, so that means it's only going to intensify the demand for clinical informatics professionals, because we're going to be needed to lead the clinical transformational change that has to happen. And I think there's a shortage of clinical informatics professionals right now because of all these things that are going on on so many levels.
Yeah,
you know,
excessive demand.
Exactly. And the compliance is also putting pressure on that demand.
Yeah, yeah. So over the next 5 years, you know, for anybody that's considering this field, I think you've spoke to a little bit of it, but is there anything additional that you would see as that would impact the role of the clinical informatics professional? I
think it'll definitely be expanded, and then people are going to be specializing in certain areas.
Okay.
Because, you know, you've got all these devices, the handheld devices, because another concern is patient privacy and security, and that's in itself is a specialty. So while right now people are practicing at a generalist level, eventually as these, you know, trends continue and then organizations reach a level of maturity, then there's going to be clinical informaticists that will be more specialized, and then getting more certifications or advanced degrees. It sounds like then that the large scope of work that you've done, right, and the vast experience that you have in this field, that people are going to end up coming in and maybe doing one piece of it because of the demand in the near future, perhaps. Yes. Is there any advice or guidance that you would give a nurse that's considering moving into this field? What do you think would be the greatest challenge that they might face moving from nursing into this role of a clinical informatics? I think the greatest challenge is finding an educational delivery system that will support their schedule, because there's different learning methods now. You can go online or actually go to a university and attend classes, and if they can work go to school full time, it's a lot easier than doing both.
Oh yeah.
But it's really important to have that patient care experience, because a deep understanding of the clinical and hospital operations is really the foundation. And the information technology is really a tool, it's an enabler, to accomplish the goals.
You've worked for associations that support this field. You have been you are a practitioner in this field and have done a variety of project work. Can you share with us, something that you're particularly proud of that would kind of give us maybe real world a sense of what that was and the impact it had?
Well, I was involved in this very large project in a hospital where there were like 5 critical care units, and the hospital administration could not afford to have 5 separate clinical information systems. So the mandate was to bring these critical care units together and select one system to be used in these different environments, okay? So, and the environments were very diverse. You had a pediatric intensive care unit, you had a surgical intensive care unit, medical intensive care, neonatal intensive care, and then a burn unit. And they all have very different requirements as far as their data, how their information is, captured, and their knowledge that's extracted from the information. So, and it was a pretty long and time-consuming process. I had to go to each area of specialty and analyze their requirements, speak to the end users, and I had to collect all these requirements and then determine the technical specifications that are needed so that they can have the optimal system performance in their units. And so I had to gather requirements and, put them organize them in a way that we could look at all of these requirements and come to a consensus. So that I had to put them in an evaluation report. And all the users had to visit vendor demonstrations to see all what was out there for them. And then we had to narrow down the vendors. And then each of the specialty areas, they had user representatives, and they each, got to evaluate the system and then gave it a score. And after the evaluation period, it looked like all 5 of them came to a consensus to one critical care system.
Wow.
And so the fact that they were able to come to an agreement and one was chosen, that was a pretty big accomplishment for me. The climate was such that the politics of the project, one way would be adversarial, the next way would be friendly or cooperative or collaborative. So it was somewhat trying to be politically savvy, is the word.
Interesting, yes, and that can be challenging, especially when you are so immersed in such a complex project. How many people were involved, and what scope of time?
There were 30 people involved.
Wow.
Because each of the units had their representative, and then we had people from nursing administration and the administration. Scope of time, I would say 9 months.
Is that a pretty typical?
I thought it was longer than usual, but that was just the nature of the project, because we were talking about 5 departments.
Yeah, right.
And the fact that they could come to an agreement was, was
I'd say that's
interesting.
impressive.
Yeah.
Quite honestly, when you have 5 different, groups, specialty groups that have to merge and try to find some compatibility.
Right.
And that's quite impressive. Now, of those, so this is the kind of process that you described. Is that pretty typical?
Yes, it is.
In terms of the different activities and the parties involved, and because it's very complex and
it is.
When you've got 30 people and you've got 5 different groups, and you're trying to. That was quite an accomplishment. Is there any advice that you would give to somebody that's considering the field?
Yeah, for starters, for those nurses who want to get into clinical informatics, my advice is to be aware of whether your organization has a clinical informatics department or is it an IT department. And then whenever there are any initiatives to start a system implementation, volunteer to be a super user.
Okay.
So that you can be involved in the, from the ground up.
So they get an experience from a nurse's while they're as a nurse, they're still getting some experience.
Exactly.
Exposure.
And then, because that's a good way to learn the system. And then you work together with the other analysts and then, the other vendors who come. And then that's a good way to transition if you want to now get into
Now they have some exposure, they can determine if it's right. Liberty, thank you very much for being with me, and we have to call this a wrap. You've been a great guest and very informative. On behalf of my guest and everyone here on the set at Your Career, I'd like to thank you for joining in today. I'm Debbie Featherston, your host, and remember, be career happy.
More information about this program is available online at millermediagroup.org.